Hi, good afternoon everybody. I am Dr. Rahul Kashyap, heading the Department of Dentistry and Maxillofacial Surgery here at Bensups Hospital. We've already had a series of interviews before. They were all meant for your knowledge and just to introduce you to some of the newer concepts and newer fields regarding dentistry and the latest advancements that you can seek. I think we've already had discussions regarding implantology, we have had discussions regarding various cystic malformations in the of the jaws. Today I was thinking of discussing a topic which is rather close to my heart. I know it is a topic that deals mainly with cosmesis. It comes under classical cosmetic surgery, but what I have seen that rather than being hardcore cosmetic surgery, this is a topic which has got a lot of functional implications as well. And the main thing that I feel that I have observed after starting private practice here in Delhi is that there is a very general lack of awareness regarding this particular topic. What I'm talking about is a topic called orthognathic surgery. Now, orthognathic surgery basically deals with deformities of the jaws. Now, this deformity of the jaw could either be in the upper jaw or the maxilla or the lower jaw, that is the mandible. Now, deformities as in what I am talking about are not only congenital deformities or traumatic deformities, but they are mainly acquired deformities or genetic deformities, and which leads to different irregular growth patterns of the jaws, in which a patient might experience lengthening of the face or shortening of the face, an anteroposterior deficiency of the jaws, an anteroposterior excess of the jaws. That means the chin might become very prominent, or the upper teeth might become very less prominent, that they are not visible. Not only the upper teeth, the upper jaw as a whole, even the nose, it becomes so deficient that when the patient speaks, you can actually make out that he has got speech difficulties also, he's got breathing difficulties also. There are so many other attributes which are associated with these deformities. And the sad part is that I have come across a lot of patients who have got absolutely no idea that these deformities are correctable. We can actually correct them, and that is where orthognathic surgery comes in. Now, orthognathic surgery means that we do a surgical intervention to correct a particular deformity. Now, if we are talking about the maxilla or the mandible, yes, it is a major surgery. It involves hospitalization, it involves artificially induced fracture of the jaw bones, and then we manipulate them and we bring them to the desired position. And once we have done that, we use plates and screws like we use for fracture cases, for trauma cases. The same plates and screws we use to stabilize those fracture fragments and to keep them in the new positions which we have thought of. Now, these are of course, as I said, these are major surgeries. They will involve a minimum hospitalization of 5 to 7 days. The surgeries will be done under general anesthesia. It is not possible to do these surgeries under local anesthesia, and they generally involve a multidisciplinary approach, as in we will require the support of an orthodontist, that is a specialist of braces, because of all these skeletal deformities, because of all the malformation of the jaws, there are a lot of irregularities that develop over time in the teeth. So the teeth become very irregular, they have various, they grow in different directions, they have overlappings, they have unnatural tilting. So we have to correct all of them before the surgery and after the surgery also. So plus it needs the support of sometimes we also require the support of a prosthodontist, because we might have to give some we might have to give some crowns and bridges also to cover up certain deficiencies which cannot be covered either orthodontically or surgically. So as a whole, I would just like to bring to the knowledge of our viewers that if you find somebody in your circle who is suffering from these problems, somebody who's got a loss of function or a loss of facial aesthetics because of, say, a deficient upper jaw or a protruding upper jaw, a very very prominent chin or a very very deficient chin, a very short mandible. People even might have breathing disorders because of the deficiency of the mandible, of the lower jaw. At night when they go to sleep, in extreme cases we have got cases of even obstructive sleep apnea, which could be happening because of mandibular deficiencies. We might have patients or people who have an excessive gummy smile. That is, whenever they speak, whenever they talk, only a part of the upper teeth should be visible when we are smiling or when we are talking. In certain cases I have seen, we come across it very often, that a very large portion of not only the upper teeth but the upper gums as well are visible when the patient speaks or when the patient smiles. Now that creates a very unesthetic, a very disproportionate kind of a look on the face. So in that case, all we have to do is trim a part of the upper jaw, because clearly the patient is suffering from a vertical maxillary excess. So the upper jaw is very long, is longer than it should actually be. So we have to just trim that excess part, maybe 6 millimeters, 8 millimeters, 10 millimeters, and reposition the maxilla, the upper jaw, in such a way that excessive smile, that gummy prominence, that gets taken care of. So it's just for your knowledge sake that treatments for all these kinds of problems are available. I have come across a lot of people who have just taken it in their stride, who have accepted it, that this is what they have been blessed with and this is what they have to live with. They have absolutely no idea that these things are treatable. We can definitely improve a lot of the facial aesthetic features of the patient. And not only that, whenever there is a dentofacial deformity, whenever there is a skeletal deformity of the face, it not only affects the cosmesis but the function as well. Over a long period of time, the patients might suffer from temporomandibular joint problems. The patient might suffer from excessive attrition of the teeth. The patient might suffer from other breathing related disorders. So all these things, they can be taken care of. There are modalities which are available, which are practiced. The only thing is they are not very popular, especially in the northern part of our country. If we go down south, or if we go towards the eastern side of India, Calcutta and Bangalore or Chennai, for example, these surgeries are very very commonly performed because there is a very good awareness about all these procedures. So this is an effort from our side to create an awareness that yes, these sort of procedures are possible and they can do a lot of benefit for the patients who are suffering from such kind of